We've got a few introductions this evening before we kick off the meeting itself. I'm Shirley Roebuck. I'm a registered nurse. I'm an employee of Chatham-Kent Health Alliance. I work at the Sydenham campus in the Emerge. For now. Forever, yes. We also are privileged to have some of our elected officials here tonight. We have representatives of the Chatham-Kent Municipal Council. Could everyone stand and wave? Everybody will know you. I know Sheldon Parsons is here. Who else is here? Our provincial politicians, our MPPs from Queen's Park were invited. I'm not sure whether anyone is here. They're on their way. Excellent. They're on their way. We're also very privileged to have Jeff Wesley here tonight with us. Everyone will know Jeff. He is a respected community leader who has been involved in the various campaigns to save Sydenham campus over the years. So the nurses are very, very happy to have Jeff supporting us. Thanks, Jeff. I'd like very quickly just to introduce the employees of the Sydenham campus. We're not going to differentiate between groups. We're all in this together. What affects one affects all of us. I'd like any employee from Chatham-Kent Health Alliance Sydenham campus to stand, please.
We don't want to be on.
We have a few more honored guests too. We're very happy to have the director of the Ontario Health Coalition with us tonight, Natalie Mehta. Natalie's traveled down from Toronto to attend our meeting tonight. And we also have representatives from the Strathroy Save Our Hospital campaign and the Sarnia Lambton Health Coalition. Could everyone stand, please, and be recognized? We appreciate your support.
First of all, I really want to give credit to Shirley Roebuck and the local nurses because they're the ones who have taken the lead on organizing this. And I spoke with Shirley on Sunday and offered to get involved, and we're here because of them. So they're the ones that need to be thanked. Obviously, as we go through the presentation, I'm going to give you some basic information on the decision and what it all means. Then we're going to get into what I'll call the better part of the presentation, which is some of the aspects of the report which I disagree with, and some of the impacts on the community. If at times I sound a little aggressive, ticked off, disappointed, it's because this community should be. Because you know what? Going back to 1988, that's when, under the leadership of Matt Militek, we raised money for this hospital, $2 million worth. We're back at it in 1991. We've been back at it, seems, every 3 or 4 years since then. The last time we were at it was in 2003. And quite frankly, you know what? I'm sick and tired of them coming after our hospital. I'm sick and tired of them coming after our emergency room department. And I will apologize that we have to go through this again, but you know what? We need to. And I want to emphasize something as well. I don't care whether you're a supporter of the NDP, the Liberals, the Conservatives, or you're apolitical, or the Green Party. You know what? You're all welcome to come and help us. And we won't turn anybody away. But if you're a member of any of those parties and you don't support us, we're certainly going to let everybody in this room know that. So we expect them all to be supporting our cause. Okay, what we're going to do, if we could just look at the overview, we're going to talk a little bit about definitions. I'm going to talk about the impact on the community. We're going to talk a little bit about paramedics. And we're going to talk about where we're going to go from here. It's important to understand there's about 20 slides in here. Some of them I'm going to go through fairly fast. Others I've got a lot more to say on, so please bear with us. Once again, if you can't hear me, please speak up and I will talk as loud as I possibly can. We're also going to talk about what the LINs are, a brief of the Hay Group report, some of my thoughts on it, and some suggestions that they give for Sydenham District Hospital. Okay, what is the Local Health Integration Networks? And that's their website up there. They are a community-based nonprofit organization funded by the Ministry of Health and Long-Term Care. They were put in place to plan, fund, and coordinate health services in this area, in the Erie-St. Clair area. They're a government-appointed group that is responsible for over $900 million of healthcare services for Sarnia, Lambton, Chatham-Kent, and Windsor-Essex. They are accountable only to the Premier, Dalton McGuinty, and the Minister of Health, David Kaplan. So I think we're starting to see early on where the focus of some things we're going to do is going to be. Although the Health Alliance is not going to be unscathed, I have to say as well. Within the Hay Group report summary, let me pull out some of my own personal notes. Okay, so the report was commissioned by the Erie-St. Clair LHIN to study 3 rural emergency departments within this district. Interestingly, when compared with 17 other rural hospitals across Ontario, Sydenham campus was at the high end of seeing critical patients. That's a good thing. We had a lot of critical patients we were seeing. Sydenham has approximately 21,000 visits per year to the emergency department. And Sydenham's emergency department program is connected with the Chatham site, and together they face many challenges. Remember, this is coming from the Hay Group, okay? The physical plant is inadequate by current standards. Well, I'm going to point out a couple things to you right now. I had a chance to look at the report quickly today, and when you talk about, for example, where they talk about the physical plant is inadequate by current standards. Well, if you go to page 32 in the report, they actually say that. The need for a major redevelopment, not only for the emergency department, but the entire physical plant. If you go to page 29, they also say that. But I've been told, and this is not confirmed, but I'm going to look into it, but I have been told that some of the better physical plant at the Sydenham campus was in fact removed and sent over to Chatham. And I find it interesting in the report where they talk about the physical plant. When I look at the list of people that were interviewed, when I look at the documents that they looked at within the report, I don't see anywhere in that report where they talked to anybody who knew anything about the physical plant at Sydenham. I don't see where they looked at any reports or interviewed any people. And in the report itself, there's one paragraph on physical plant, yet they can come out and say that the physical plant is inadequate. I think that's rubbish myself. Another thing when we're looking at the Hay Group report, they indicate that when compared to the 17 other rural hospitals, I looked at the actual chart that they had in the report. So if you go to page 32 of the report, bear with me, if you go to page 32 of the report, it says, very low visit volumes, which, particularly in the light of the low volume of CTASA level 1 and 2, which are the more critical, more emergency, life-threatening visits, and the proximity of a full-service site in Chatham, make the viability of the Wallaceburg site questionable. Remember that word, very low visit volumes. If I go in the Hay Group report to their very own chart on page 29, I look at those volumes. Well, for the CTAS1 level, the very most critical ones, out of 18 comparable hospitals they looked at, there was only 4 that had more of those type of visits than Sydenham. So we're in the top 5 in terms of critical, emergency, life-threatening visits. That's number 1. When I look at the CTAS level 2, which is a notch down from that, there's only 1 hospital that has more people visiting with those type of things than what Sydenham has. So we're at the top of the level of that one as well. When you look at levels 3, 4, and 5, we're average with everybody else. When you look at total visits of over 21,000, we're right in the middle once again. So once again, for the report to come out and say that we've got very low visit volumes at the Sydenham campus, as far as I'm concerned, by their own report, that conclusion is also rubbish. We have the volumes taking place there to deal with that.